Come in.
Hi, Kira. How are you? Good. Good. I'm Diane. I'll be your nurse today.
Hi.
Hello.
Yeah, she's feeling a lot better, which is great. Do you know when the doctors are coming back? Because you haven't heard any results from the test or...
Yeah, sometime this morning. I heard it's Dr. Welby. He's one of
Dr.
our
Welby?
best, one of our best neurologists. Kira, you're gonna love him. He's
Yeah.
been here for a long time. He's great.
He's really experienced.
He's the most experienced neurologist we have.
Wow. Okay.
Yeah,
No,
yeah.
that's good. Okay. All right. So you think this morning?
Sometime this morning.
Okay.
Yeah, they usually make rounds in the morning. So, yep. Nice to meet you guys. Okay, do you have any other questions?
No.
Okay. We'll see you guys later. Bye-bye. Bye, Kira.
Come in.
Hey Kira, how are you?
Good.
You know, I have a granddaughter named Kira, and she's not as pretty as you, but almost. How are you? Dr. Welby, how are you?
So nice to meet you.
Well, I'm the neurologist, so they asked to come and see your daughter. The problem is that fortunately she doesn't have a brain tumor, but these spells we have to treat, and the medication she's on is not as good as the one I want to put her on. So I'm switching her to something called Keppra. And frankly, I don't know how to put it into the computer system, so I've asked our resident to come here and help me do that.
I'm so support we put the order
Oh,
really quick.
Okay, but we're going to
Talking
start
really
that
fast.
med today.
We're starting that med today, but the problem is,
Yeah.
because we're starting a brand new medication, we have to keep her in the hospital for at least 2 more days just to watch for potential side effects and allergies. As a
Okay.
rule, they don't occur, but it's better to be safe than sorry.
Okay, sweet. We can't go home. I'm sorry.
Is it okay, Kara? You're gonna have to stay, okay?
We'll watch some movies.
Okay.
Okay.
Any
They're not
que-
going home today?
No, they're not going home
Oh,
today.
okay.
Okay.
So do you have any questions?
No, thank you. So the new medication today, and then we'll just watch her.
Watch her for a couple days, and then
Okay.
I'll see her in the office in about 3 weeks.
Okay.
And just so you know, I'm not going to be able to put my note in today as I go to clinic, so it might be later this evening.
Well, please get it in, because otherwise my boss is gonna be very upset.
Yeah, okay.
Okay.
Thank you.
Yeah,
Well,
Bye.
Well, thank you.
Bye.
Thank you, Dr. Welby. I
Thank you.
appreciate it.
good to meet you.
Hi.
Hi. Are you Kira? Hi, my name's Marianne. I'm the pharmacist.
Oh, hey. Hello.
Nice to meet you. I'm here to talk to you guys about you're getting Tegretol.
Great.
That's the medication that we recommend. She's on the perfect med, but we just need to adjust the dose for her weight.
Her dose?
Mm-hmm.
Well, Dr. Welby, the neurologist, was in here, and he said she should be on a different medication. Did you talk to him?
Dr. Welby? I'm not sure if I know him.
Dr. Welby? He's like the neurologist here?
Okay. I've only been here 5 years. Maybe I don't know of him, but I will go and take a look and see if I can find out who he is and what med he's talking about.
Okay. All right. Come in.
Bringing in a lot of people here. Hi Kira, how are you? Good. Mrs. Wagner. I'm Charlene Murphy. I'm the senior resident on the team. We spoke earlier.
Great.
As I promised, I brought in the full team. This is Dr. Austin. He's the attending physician.
Nice to meet you.
This is Dr. Crossan. She's the intern.
Right.
And we have a couple medical students. This is Ben and Rachel.
Okay.
So the plan is that we are going to sort of talk about Kira, discuss the plan, and then answer any of your questions that you may have.
Okay, that sounds good. I'm just a little confused this morning, so but I'll let you guys talk. So go ahead.
Okay, so Kira is our 8-year-old female who was admitted last night with increasing frequency of spells that are concerning for possible seizure. So in summary, our plan for today is that we think Kira is ready to go home. It seems like the dosages we have right now for her medications are working really well, so I'm happy to either fax those prescriptions or give you a written prescription if you want to fill those at our pharmacy before you go.
What are you talking about? You guys call yourself a team? I can't get the same story from any two people who come into this room and talk about my daughter.
Oh, I'm so sorry. I didn't realize that was happening.
We have to get this straight.
Hi, Hank. Hey, it's great to see you.
Hi, Jenny.
Hi, great to see you. Hey, look at our first patient is just checking in. Now I know it's your first day of the rotation, so I want to go over some things that we're going to be doing today.
Sounds good.
All right, so let's go in here. This first patient should be interesting, has some classic features. Most of the residents find that they can see really good by sitting there. You know, I find it really fascinating to watch these kids demonstrate kind of subtle classic features. It's really interesting. I think you're going to find it useful, but remember the walls are really paper thin, so you have to try and be as quiet as possible. Oops, I'm getting paged. They must be ready. I'll see you in a jiff.
Oh, okay. This is great. I don't know anything about this patient. I guess I'll just watch and relax.
Okay. Because if they will, I'll probably try to send this to them.
What time is it? This is boring. I don't know anything to look for. I don't know anything about this patient. This is not going to be any use to me in my career in the PICU.
So hey, are you ready to talk about this? Did you notice all the repetitive, stereotypic movements that the child was demonstrating? He has a lot of classic features of autism. Did you notice how Mom was beginning to describe his speech at the beginning? I was just so glad that this was your very first patient of the rotation. This is so exciting. So, well, what do you think?
It was good. I saw some stuff and yeah, it was good.
Hi, Tom.
Hi Tracy. Good to see you. Really missed you. It's been a long 3 months. What can I do for you?
Yeah, I'm really glad. I know you're super busy. Thanks a lot for meeting with me. I was coming today to talk with you about some things that I have on my mind, and I know that I've just been back from maternity leave and for a couple of weeks now, and I think I told you my daughter was born like a month early, and we've had difficulty feeding, and really we're just now getting the reasonable sleep schedule back. So I was coming to talk with you about the possibility of changing my work schedule. I've thought about it a lot, and I've done some research, and I wanted to show you this. It's research about women who go part-time, especially when their babies are pretty little.
Yeah, I've heard about this at some of the executive committee meetings. The problem with this is, women who do this sort of thing, some of the other division chiefs have said they get marginalized. Nothing works, then they get frustrated, they end up quitting, and it becomes a total mess. It's a lose situation for them and for the institution. Trust me, I know what I'm talking about with this. It's problematic. I mean, don't you have anyone else to help you? Don't you have a grandmother? Or what about your husband? Can't he go part-time? And this is a critical time in your career. It seems to me he should be more supportive of you. After all, you're in academic medicine. You had to understand that when you joined the faculty.
Yeah, we don't have any family in town to help out, and my husband just got another job a couple months ago, and so he's not really in a position to cut back on his hours. And I think I have all this debt from residency or from medical school that I've deferred through residency and fellowship, and so it makes most sense for me to cut back because our salaries, are so low here, and then he's not really in a position to cut back.
Well, the problem is when we hired you, you're right out of fellowship. It's a clinical position we're looking for. I mean, it really requires, clinical presence and teaching. We also hope that you develop a research career during this time. And there's a lot of clinic time to be done, and quite honestly, it puts a burden on us. I have a couple of leadership roles I've just taken on with NAPI and the AAP, so I plan to be traveling a lot over the next couple of months. And John just got an RO1 award, so he's going to need to have dedicated time for that. And I don't know if you've heard about Kate, but she just got, 3 manuscripts published just in the last 2 months, with a very promising research career that we don't want to sacrifice. And we've all been picking up the slack while you've been gone, and it's been a rough few months for all of us. And you've just had 3 months off, kind of a pseudo vacation, if you will. And when I was a junior faculty member, if I came into my division chief and told him I wanted 3 months off every time, I had a child, they would laugh at me. It's crazy. Were you able to get any research done while you were home?
Well, I think I talked to a lot of women who are in other departments, and they've been able to help me develop a schedule. I actually have some ideas here that I want to talk with you about how I could maybe go to 0.6 or 0.8 FTE. I think it's one of those things I was hoping that you'd be supportive of.
Well, I'm afraid I really can't approve of this right now. It seems to me that, if working here really disrupts your, quote, work-life balance, then maybe this isn't the right job for you. Maybe you need to start looking for another position at some place that can accommodate your needs.